Hi, I'm Christina Musser, and I'm going to talk about telehealth compliance in a post-pandemic world. As most of you know, the end of the public health emergency is near, and that's exciting. And telehealth also will continue, which is also exciting. However, we need to think about compliance now as we move into this post-pandemic world because guardrails will be going up. This shouldn't scare you. You just want to make sure that you are aware of it and that your organization is set up to make sure that you are compliant around telehealth. Licensure and malpractice compliance, documentation, privacy, billing and coding, and operational compliance are all things to think about, and we're going to briefly look at those. Licensure and malpractice, are you working within the scope of your practice and licensure when providing telehealth? Great question to continually ask. Do you have a license in the state where the patient is physically located at the time of service? That would require that if you have patients in multiple states, that you have multiple licenses or are working through licensure compacts. Do you have appropriate malpractice coverage? This is something that's often overlooked, but making sure that you have the required malpractice coverage for the locations where the services of the patients, the locations of the patients for which you're providing services. Documentation compliance, just making sure that you have the consent and disclosures documented appropriately, the location of the patient and the location of provider, documenting that you are using a secure platform and that it meets privacy and HIPAA guidelines, and that all requirements of the code that you're billing or the service that you're doing is documented. Billing and coding compliance. So this is the mechanics, making sure that you have the appropriate CPT code, place of service, and modifier. This will be governed by your payers. And just know that this will vary by payer. So you want to make sure that you have a system by which you're tracking what each payer requires. And I would recommend that you leverage your EHR to build in some logic around this. Operations compliance. Clinical guidelines, very important to have around what's appropriate, what's not appropriate, and how you're going to escalate issues that need additional or in-person care. Obtaining and storing consent, can it be verbal? Does it need to be in writing? Does it need to be a wet signature, or can it be electronic? All those workflows need to be outlined and documented. And then provider and staff training, very important that provider and staff are trained on equipment, workflows, and privacy. Although it's healthcare, this is a new way of delivering healthcare, and there should be education around that and resources and support for them. And then finally, audits, just to make sure that you're staying on track within your organization, double check and include it in your audit, in your regular audit cycles. So finally, you want to make sure that you establish governance and owner for telehealth compliance. Don't just leave it up to everybody. Make sure there's a point person or group within your organization that will take this on. Incorporate and develop compliance policies, and really leverage your EMR to make sure that you are using templates and prompts to capture documentation. Don't leave it to memory, and that you're capturing all consent requirements. And finally, again, really make sure that you're adding telehealth service into periodic audit cycles. If someone was to come in and look at your organization, they just want to make sure that you are trying to do the right thing, and it's important to document and demonstrate that. Thank you for listening today. If you have any additional questions about telehealth compliance, you can reach out to the Virginia Rural Health Association or Blue Cirrus Consulting.